Hi, I'm Dr. Quentin B. Allen. I'm a refractive and cataract surgeon at Florida Vision Institute, and I practice in West Palm Beach, Stewart, Jupiter, Port St. Lucie on the Treasure Coast. A cataract is actually just a clouding of the eye's natural lens. The eye is very much like a camera. There's a natural lens that focuses light onto the retina, which is like the film in the camera. So if that lens becomes cloudy, which happens as a part of the natural aging process, then that in turn is now called a cataract. So when it gets to the point where that cloudy lens is obstructing light and causing symptoms, that's what we would call a cataract. Cataracts can certainly be hereditary, but typically cataracts are a part of the normal aging process. In the hereditary case, someone may present at a younger age with a cloudy natural lens or a cataract, but for most people it's just a part of the natural aging process, where if you've got gray hair or wrinkles, then you're probably going to have early cataracts, with the typical age for cataract surgery in the United States being 67. Cataracts can produce multiple symptoms. Most people don't wake up suddenly overnight with a drastic change in vision from cataracts, however. It's usually more of a gradual process, but some of the major symptoms that people would notice would be, first, colors seeming a little more muted, less vibrant, needing brighter lights to read, and of course driving at night becomes a more difficult proposition with early cataracts. The lights can be scattered with halos or glare around oncoming headlights. Cataracts can only be diagnosed by coming to see an eye care provider. So when you see your optometrist or ophthalmologist, a dilated exam will then demonstrate to the clinician that the lens has become cloudy, and that's when they would make you aware that you're developing a cataract. Now you can assume, if you're of a certain age, that perhaps you might have cataracts if you've had a slow decline in vision, but other things can also cause a slow decline in vision. So it is really important to have a dilated exam to demonstrate that this is indeed just a cataract, and that's a good thing to know because at least it can be fixed. The question of when an individual needs cataract surgery is very individualized. It really depends on an individual's activity level, their occupational needs, and for some people we may be able to delay cataract surgery safely, but for others we may want to perform cataract surgery at a much earlier stage. Say, for instance, an airline pilot or an occupational night driver, we may operate on those patients at a very early stage of cataract because their visual needs are very high. Somebody who's retired, who just likes to read books, may be able to delay cataract surgery for many years. So it really boils down to that individual's needs. With modern day cataract surgery, recovery is extremely rapid. Especially with laser-assisted cataract surgery, we expect to see visual recovery in a few days, but for almost every patient having cataract surgery, at the worst, in a few weeks, the vision should be improving significantly.